Hello and welcome everyone. Today we will be discussing how to do a literature search. So why do we do a literature search? Mainly if you are doing some kind of a research to guide your ICU management decisions, to get your latest evidence-based intervention that you can do at the bedside. So before we do a literature search, we need to define the research question. So start with a clear, focused clinical question. Without this question, you will never be able to do any kind of a literature search. So use a framework like this, that is the PICO framework. You must define your patient population, the intervention that has been uh, decided or you want to search for, a comparator group, and an outcome. Say, for example, you want to see whether I want to use steroids in acute respiratory failure. So your patient population is acute respiratory failure. The intervention is steroids. The comparison is any control group, and outcome is whatever you want to see, whether it is mortality, whether it is ventilator days, or some other parameter. So now, based on that, once you start the search, you might need to narrow down the scope to ensure a manageable search. The example that I just gave will give a lot of results because the causes of acute respiratory failure are many. So if you want to be more specific answer and less number of studies, because you can't manage, say, for example, 30,000 results. So you need to narrow it down to a manageable thing. So to reduce it, you may reduce it down and write the patient population to be, say, bacterial pneumonia. So that will narrow down your search from, say, 30,000 to uh, probably 2,000, 3,000, like that. So this type of narrowing down and managing has to be done at every step. The example that we have given here is the mechanical ventilation ICU patients, that is the patient population. Early mobilization is the intervention, standard care is the control group, and looking at the improved functional outcome is the outcome. So once we have a research question, that is, in mechanically ventilated patient, does early mobilization compared to standard care improve the functional question? Now I have a question. Now I need to put it in a database where I can search this. So the most common one that we use is the PubMed or the Medline. Cochrane library is must if you are doing a meta-analysis. Embase, Scopus, Web of Science, these are standard and must be covered in uh, to get the broad coverage of all the articles that have been published. Now, Google Scholar is not something which I will recommend to do for the initial literature search, but you can do it for quick searching or citation tracking. For example, nowadays with the use of AI, we get a lot of citations that are fake. So you can find out which citation is actually present and which is not there. And also you can track around how the citation is being done. So you can track the citations. One article after another, you can get a lot of supplementary articles from in Google Scholar. So what is next? The next is to make a search strategy. To find a search strategy, you need to identify the keywords. This is very important. The question that we made had some keywords. Now include synonym of those keywords. Say, for example, we had functional outcome. It could be functional recovery. It was early mobilization. It can be early ambulation. So find alternative spellings or synonyms like that. Make a list of those words. So for ICU, it can be intensive care unit, critically ill patients, like that. Uh, these are called free vocabulary. But then there are something which is called controlled vocabulary. Controlled vocabulary is a inherent part of the databases which you can use to more refine your search and make your search more effective. Free vocabulary will give you a lot of results but may not be very specific to what you are searching, because the database is not searched based on those specific terms. Because if you do with controlled vocabulary, you will get more better results and more effective and specific matches. So in this, you must have heard of the terms that is called the mesh terms. This mesh terms are for the controlled vocabulary. And for Embase, it is called the entry terms. And combining these terms with and or will give you a search strategy. So, for example, we need for all the synonyms that you have found, like early mobilization, early ambulation, they should be in the or factor. And since we are also looking at ICU, functional outcome, we will add those things in the and. Now, in the ICU, you can keep on adding the or based on the synonyms. ICU, critically ill patients, like that. And then and functional outcome, functional recovery, like that you need to add. So just I will show you how to find this mesh terms, because I will be focusing on PubMed mostly. So what you see here is the PubMed website. In this, the mesh terms are below. If you go down, you will find here mesh terms. So you can click on it. If you click on it, it will go to the mesh terms. This is mesh. So here, say for example, we are looking for functional outcomes. So as you can see, there is no such term found. For early mobilization, let's try to search. Early mobilization is there. So once you do that search, it will give you a lot of mesh terms. These are the mesh terms. You can use these terms in that or factor that I have told, or synonyms, to more refine your search and get better results. So you can get a lot of more articles by using this type of searching. So you just need to type in the words that are here, and then you will get the mesh terms over here. So now that we know the mesh terms, we will do a sample search by using this strategy that we have just learned. So here we have used intensive care unit, which is a mesh term. And in this, we are using the synonyms, that is critical care and ICU in or. Then we are adding the respiratory mechanical ventilation. So the mesh term here is respiration as artificial. We are using the free language, that is mechanical ventilation, ventilated patients in the or. Then we are adding and we're using early ambulation, early mobilization, and early rehabilitation. We are adding and you looking at the outcome, that is the functional recovery, functional outcome, and functional status. Functional recovery is the mesh term over here. Outcome and status are our free vocabulary. So this is what is called a search strategy. This has to be a thing which you need to present to the journals if you're going for a meta-analysis, because this actually shows to the editor that you have actually done a proper search or not. So this search strategy is specific for PubMed. You need to go and learn the search strategies for Embase and Scopus. They're similar, but they have certain modifications because of their user interface. So let's use this search strategy and see what result we are getting. So how do we get to this place? I will tell you how. Once you reach the PubMed website, don't use this particular site. Go to the advanced. In the advanced, you can write each term over here and then put a bracket and keep it down. So you keep on adding like this. Then you use this Boolean vocabularies, that is and, or, and not. Using this, you keep on adding various terms. The term that we have made is this. So we have made each term based on this. Like this, we have created this search strategy. So now let's put this search strategy and see what is actually happening. So once I put this search strategy, I get some results. So I got 24 papers. So next phase that we will go through is we will try to again refine our search, because this is a very small topic. That is why you got only 24 papers. But if you say go for steroids in respiratory failure, you're probably getting hundreds of papers. So you can't possibly be going through all of them. So the next stage will be the initial stage of refinement, which are called the filters. Say for example, if there are a lot of papers, I will try to see the papers that have been published in the last 5 years. So I'm down to 9 now. Now next I will see if I can find the free full text. So if I select the free full text, I'm down to 5. Next is if I am looking for systematic review or meta-analysis. So as you can see here, there is no systematic review in this. So you can use like clinical trials, various options are available. There are additional filters like English, Spanish, humans, age, sex, and various terms are available. So using these filters, the basic idea is to reduce and narrow down your search, because the next task is going to be difficult. So now that we have 5 studies with us, next what we will do is we will try to look at the abstract of each study. So next step will be studying the abstracts. So this is how you get to the abstract. Now, in the abstract, your main objective here is to trying to find the study population. So as you can see here, we are seeing that it's a single center randomized trial. This was 80 patients who were admitted to the ICU and expected to be ventilated for the at least 48 hours. So that looks to be like a patient population I am interested in. Say for example, it could be a post-renal transplant patient. So then I am probably not interested. So in this, first look at the patient population. If the patient population interests you, keep that study. If the patient population is not there, then just remove the study. Next thing that I'm looking for is the intervention that has been done. Am I looking what intervention is being done here, and am I interested in it? It is a rehabilitation protocol. Yes, I'm interested, so I will keep this study. The next thing I will look for is the outcomes that have been looked. Say for example, I'm focusing on mortality. If the mortality is predicted, given or not, or say functional outcome is given or not, what method has been used. So I can see the functional status has been given by some kind of a scoring system, which looks good to me. Next, you can also look at the journal it has been published. It has been published in Critical Care Medicine, which is a pretty good journal. Uh, so this is a study which I will probably keep. So like that you go, this is at the initial stage of screening, where you still, just by looking at the abstract, you try to keep some of the studies and remove the rest. The next step will be to look at the full text, because now that I have reduced to the articles which I think I'm interested in, now I will look into more details. So in this, you look again at the patient population. What exactly was this ICU? What type of patients were in this ICU? And what were the definitions that have been used for the various outcomes? So look at the rehabilitation protocol. See if can you do this at your own setup, or if you want to do more research on this. If the rehabilitation protocol is not something which you are satisfied with, probably you don't need to do more search over here. Other protocols, then interventions, as we have seen. Next, the main thing that you look for is the outcomes. Look what outcomes have been seen. Are these outcomes been assessed by some standard scoring system? Is this functional status score something established, or something just made up by the authors for this particular study? As of now, it looks like something which has been done authentically, and it is based on some evidence which has been done prior. So probably this looks like a pretty good study and something which I will keep for my referencing. So this step is called the critical appraisal. You did all the analysis, and now you have found out that this is a study. These are the list of studies that I'm going to keep. Now that you've made a list of say 50 to 25 studies for your final keeping, in that case, next what you will need is managing those references. You have 50 25 references. What do you do with them? It is best to use some kind of a reference manager. Mendeley and Zotero are freely available, but EndNote is a paid version of the thing. All the things are equally powerful. The thing with Zotero is that it is open access and open kind of a software. So there are a lot of modifications, but it does need some kind of a technical knowledge to do most of the actions of the Zotero. EndNote is paid, not that expensive, but if you are interested, you can start with Zotero, or if you have the money, then you can buy EndNote also. But whatever it is, please use some kind of a reference manager, because without that, you are going to lose all the hard work that you have done. You can organize the referencing that you have done based on folders inside them. You can regularly update them with research, so that you are staying up to date. And the final tip before how to proceed is start with a broad question initially, because I'm not sure how many studies I'm going to get. If I get a large number of studies, then probably I will come down. But if I'm getting just 20, 30 studies, then I will broaden my search and see how many more studies I'm getting. Next, once I have a large number of study, I will slowly refine and try to find the specific niche what I'm looking for. Quickly review the abstracts and discard the irrelevant studies. So abstracts are important, and in those abstracts, look for the patient population and the outcome that you're focusing on. If they look good to you, if you say, and the study type, if it is a RCT, you're interested, go ahead. If the patient population is just 8 patients, probably you're not interested, leave that study. So the abstract gives a very quick review, and you can quickly eliminate and take up your study looking at the abstract. So this is the workflow that you should follow for effective literature search. First, have a focused question based on PICO. Identify the key concepts and the keywords. This is important. The synonyms. Choose appropriate database. But then I would suggest to use all the database. Familiarize yourself with their user interface. This is very important. Use both free text as well as controlled vocabulary. This is important. Do have an idea about the controlled vocabulary, that is the mesh terms, and use them for comprehensive coverage. Apply your Boolean operators as we have suggested. For synonyms, use the or. For the extra informations, use the and. Not is something which we do not recommend, because you want as much study as you want to get, until unless you're specifically trying to get something out. Refine the search with filters for date, study design, patient population, language, so that you get a more narrowed version. Retrieve the abstracts, remove the irrelevant studies. Again, once you have made it more precise, now go to the full text, see the articles which are good, the methodology is strong, the outcomes are properly defined and applicable, and the intervention is applicable at your bedside. Go ahead. Next, organize the articles in a reference manager for easy access and future update. And finally, consider setting up an automated alert or update of important topics like specific mesh terms in the PubMed, where the database can give you an alert if a study is published on that. Thank you. I hope the video has been helpful.